I'll leave it at that, and any questions that you might have for...
Dr. When you hear about the criticism of the slow rollout, when you hear about the criticism of getting the vaccine too slowly to older Rhode Islanders, and you say there's just not enough vaccine, can you break it down for people? Where is the rest of the vaccine right now going that there's not enough for those older Rhode Islanders? So you pushed out 5,000 doses last week, 7,000 in the next round. Where is the rest of it, and why isn't it going to those groups? If you could just tell people where it's going.
Absolutely. So the first understanding is knowing that our total amount that we're getting is low within itself. So it's not as if, you know, there's some extra stash somewhere that is not going to 75-year-olds. We need additional vaccine to come in. When I mentioned that we have 16,000 now, up from the 14,000, this next week coming is going to be the first time that we did not have to push almost half of our prior week's amounts through the pharmacy partnership, which is what was used to vaccinate seniors in long-term care facilities, as well as vaccinate our more vulnerable populations in other congregate settings. So we really had like 7,000 each week. So this week coming is the first time that we actually have the full amount that we receive that can go to the individuals. We are expanding to 75-year-olds, and I shared that we piloted that expansion starting earlier this last week. As we were able to pull back additional vaccine that had not been used yet. The remainder of the vaccine is continuing to finish the first phase groups. We had groups 1.1 through 1.4. There are people still being vaccinated in those high priority groups. True to what we have continued to say, we are not waiting to complete each of those groups within the phase to start the next group. And so that's why, as we get more vaccine, we will continue to push out more to the 75 and older.
Just one follow-up. Given the limitations that you've pointed out, the timeline that you set last week to begin 65 and older in mid-February, which is now just a week to 10 days away, is that, in hindsight, now too aggressive of a timeline, or an unrealistic timeline to have 65 and older expect to begin within a week to 10 days?
Yeah, so it will be more so the middle of February to the end of February. It's really recognizing that we want to get as much out as we can. Now that we'll be able to commit all of the 16,000 that we get to vaccine that's able to go out, it does support for being able to move the 65 and older into the range that we have said previously, and we will continue to appeal to the federal government for additional supply so that we can go further. And as we've talked about, getting through this bumpiness, continuing to see where we can refine. There have been vaccines through the pharmacy partnership, which is why Rhode Island ends up being acknowledged as one of the slower states. We are one of the states that has fully embraced that federal pharmacy partnership. Some of the quicker states went around that and didn't use it to get vaccine out, but we thought it was critical to get it to our long-term care facility groups. So as we are able to focus more on using all of our supply, we hope to be able to get to the 65 and older and push beyond that from there.
Dr. Alexander Scott, I get a lot of email from parents of kids who are playing high school sports. And with the relaxation, a little bit of a relaxation, you may not know now, but when your son plays sports, there are days that you just will not get back. And they're at that point right now. And so there seems to be this Bermuda Triangle of the Department of Health, the superintendents and the athletic directors, and then the Rhode Island Interscholastic League. And I know you've and Janet Coyne's been working with them. Why can't you start to loosen up given all of these restrictions? What is the science and the data that is driving your decision to not allow parents who will never get this opportunity again, senior years, at least have the senior parents to be able to go and watch their kids play sports?
We do have allowance for spectators to attend to the sports events, specifically taking that into account, whereas other states did not necessarily focus on that at all. So we recognize the importance. The data and science behind the decision was the understanding that with sports, we are seeing cases that are occurring in athletic events. That then brings together more families and individuals who are socializing in ways that are important for supporting the youth, and a way to help allow for the sports activities that we know are critical to occur is to just be thoughtful about limiting the spectators so a parent can attend but not have the full group in person.
Through to some superintendents, there are some districts that are not allowing any parents for any sports. Okay. So what's the word right now to the superintendents listening to this?
Well, we will take that information from you on which superintendents those are and help make sure that they have the updated recommendation that I just shared. And I want to really thank Janet Coy, the entire DEM team, Sandra Powell, so many others, and the Rhode Island Interscholastic League, who has been an excellent partner with us. We'll continue to engage with the superintendents so that they know we do want or allow for a parent to be able to support, and we'll find out from you which ones so we can get that to them.
Just one other unrelated topic. You had said in the early days, you had acknowledged Governor Raimondo, you had said her leadership was brilliant. The reality is the last 6 weeks, she's hung you out to dry. And everybody else up here, by not answering questions and having questions that you have to answer that should be in her wheelhouse. And a lot of people with these decisions that are announced today want to know who is making that decision. Is it you? Is it the governor signing an executive order? And has she apologized to you for you having to carry her water when she should be at that podium?
Well, I will 110% stand behind my statement about Governor Raimondo's brilliance and the tremendous work that she has put in and continues to put in to make sure that we have a strong structure for going forward. There are no apologies needed for that at all. We have a united team here. I'm appreciative of having my colleague, Secretary Pryor, and the entire team that's continuing to work together with the whole of government approach that we've had from the early days. In terms of engagement now, we are conducting meetings, as the Lieutenant Governor said, with both the incoming and outcoming governor together. We're making sure that there's a strong transition. We're continuing daily interactions, and Rhode Islanders can be assured that the same structure and strong approach that we've had with public health, our team, our overall COVID response team at the forefront is continuing forward.
But you can only have one governor, as Lieutenant Governor McKee has said. Is she making the decisions right now? Does she have final say on all of these things that you're announcing today?
Both governors are involved, and as we have stated, both have been working very well, collaboratively together, and supporting our teams. That's what Rhode Islanders need.
Doctor, Salve Regina has gone to sort of a lockdown situation for students. What do you say to Rhode Islanders that are concerned about, as things are opening up, colleges are back in session, that recipe right there? Are you concerned about colleges contributing to a possible rise in cases with the new variants or other ones?
I appreciate that question because I can really speak to the tremendous amount of work that has gone into ensuring that our institutes of higher ed are prepared. I want to really give them credit, give our team credit. Several weeks ago, we built out an extensive panel of criteria based on 5 categories of items that institutes of higher ed would have to have operationally strong, resourced, and ready to go in order to effectively open their doors for the onslaught of young adults to return to Rhode Island. We were detail-oriented, we were specific with them, they were responsive, they have done everything they've needed to do in making sure that the testing program is strong, Case investigation and contact tracing is strong. We applied all the lessons learned from enforcement and ensuring that students, whether on campus or off campus, are doing what they need to do, and the ability to minimize crowding and the population size of the colleges and universities. So Rhode Islanders can know that we have done all the steps we could imagine needing to do to make it so that students could return to their institutes of higher ed with all of the precautions for safety in place. We've worked closely with Salve as well as with the other colleges and universities as they're reopening. We're identifying more because we have an even more detailed testing and surveillance program in place, and we'll support each of the IHEs, knowing the tremendous work that they did to make this work and how they want to handle each of the cases. So Salve decided to go virtual as a way to respond. We have supported that and will continue to work with each institute of higher ed in ensuring that we are all doing the best we can to keep students safe and Rhode Islanders overall.
So it's not just so much for the students, but for the communities around these schools. That's where we're hearing a lot of concern. People are saying, hey, wait a minute, I live on College Hill. I'm seeing kids out and about at night, whatever it may be. I mean, that's a normal year. Should they be worried?
Yeah. Because of the work that I expressed, institutes of higher ed have systems in place where they want to know, they're monitoring. If there's something that's going on in that college or university community that they see that is of concern, go ahead and reach out to them. They'll be able to activate the resources that have been put in place to help protect against any cause for a large outbreak.
Mr. on the vaccination rollout, as that's where we're getting most of our questions about. So you're talking about 3 different types of locations to get a vaccine. That also means 3 different potential ways or avenues to register. Is that right?
Yes.
And then secondly, the CVS doses that are coming out are in addition to, if I'm correct, the supply that the state is getting in each week. Is that right?
Eventually, that is what is intended to happen. Right now, we're making sure that we have what's needed for CVS to get started on the timeline. We still need to get updates from the feds who pushed back the time frame that they told us they would have vaccine for this week. That's above what we're currently getting, and now we'll have to wait to see when that will actually happen.
Is it ultimately the goal to have CVS, Walgreens, any other pharmacies that join in here to be able to supply their own so you have multiple streams of vaccines coming in?
Absolutely.
Mr.
And have it be as accessible as possible. I also want to clarify the point that I made about making sure that those who are homebound have access. The key there was to really relay that we are doing everything to take into account all of the different possibilities for ensuring equitable access across the board. So for the homebound piece, we are still in the planning phases. I want to make sure that people are not going and calling our home health agencies right now, looking for their vaccine right now. We are still planning that, but wanted to relay to Rhode Islanders that we're taking into account all of the different considerations that are critical. But please don't start calling home health agencies right now.
Doctor, to follow up on the question involving the 3 separate types of locations to get a vaccine, to be assured of getting a vaccine, should people apply and register with multiple sites, Walgreens, CVS, community centers? Would that ensure that they get an appointment to get the vaccine?
Our goal is to make it so that any one route that you take is effective at being able to get scheduled for a vaccine. But we are purposely offering the multiple options so that people can take advantage of any option that they would like to.
They're not going to get excluded if they sign up for multiple
That is correct.
sites.
They will absolutely not get excluded.
That would ensure their, CVS talk to Walgreens, talk to the state. Is there an interplay there?
The interplay will be across the board, both on the individual. If you already have received your vaccine, you can, cancel any other scheduled appointment or not go to look to get scheduled someplace else. That's certainly happening in states, throughout the country. And then where we can, we will also be coordinating, certainly with our local and regional clinic approaches.
Mr. Pryor, to sign up with clinics, with pharmacies, multiple locations.
It is absolutely okay to do so. Similar to testing, we allow every route possible for you to be able to access.
Mr. Pryor, can we get a question from you at the podium, please? You mentioned that you're in communication with businesses and restaurants. Now, every restaurant seems to say they need the bar area open in order to make money. Now, next weekend is Valentine's weekend. Why not now open up and allow restaurants to now start to seat people at the bar area?
We in Commerce hear that feedback frequently, so we have been working closely with the Hospitality Association and the other aforementioned associations to figure out what the plans could be if there is an opportunity to reopen. There needs to be consensus within this administration that the public health conditions will permit that. Bars are one of the locations that globally, across the entire world, public health officials point to and with caution. They say reopen or open with caution. I have to say, in Rhode Island, we should be enormously proud of the bar owners and the restaurant owners with bar areas and the kinds of precautions that they have put in place. They've put the plexiglass in when such requirements existed. The evolution of this virus has evolved. The airborne nature of the virus is better understood. They've worked with us for early closure purposes. Remember, there was a bar early closure mechanism, rule that preceded the overall early closure and the stay-at-home early stay-at-home advisory. So all of this to say, we're so proud of restaurant owners with bars and of bar owners and their expertise and their professionalism. So therefore, even given the cautions, right, and even given that there are strains apparently on the way that we need to monitor very, very closely, we are talking with restaurant and bar owners about possibilities. So please stay tuned. It's possible that at this time next week we will have more that we can say, and we'll be evaluating that question closely.
Are you hearing from some restaurant owners that say, I don't want my bar open for seating?
Well, yes. There are restaurant owners. There's an entire spectrum of restaurant opinion.
Just so we
there
know,
are certainly
is it like 80-20? Like
just let me finish my response. Good question, by the way. There are restaurant owners who, in fact, don't feel comfortable reopening at all. And they're hibernating, in effect. No matter what rules we put in place, even if it were an entire open scenario, they wouldn't reopen. That's their point of view as professionals. I would not say that's the majority, not at all. There are bar owners and restaurant owners with bar areas who also just don't feel comfortable with that. The majority do want to reopen their bar seating. The scenario that they expressed to us, to be clear, is that it's not that they wish to operate a bar per se. Yes, in the ordinary times, in the old normal, they wanted to open a bar. The seating itself may be a big slice of the capacity of the establishment. So we hear that with frequency. It's very understandable, and that's why we're working so hard at it. I've got to leave it there because we're continuing to conduct analysis, but we from Commerce are continuing to provide the input on the ways in which bars could be reopened.
Now, your Rhode Island Commerce.
Secretary Pryor.
Let me follow up. Governor Raimondo is going to be Commerce Secretary. Have you talked to her about going to Washington? Would you go to D.C. if Governor Raimondo asked you? I'm
not going to characterize my conversations, the private conversations that I do have with the outgoing governor or with the incoming governor. So if any of us have more to say on any of these issues, we will say it.
Did you see her State of the State last night?
I did.
Okay. You deal with all businesses, some owned by men, correct? Some owned by women, correct? Governor Raimondo last night said the pandemic has affected women more. Do you agree with that? Do you deal with business owners? Have female business owners somehow been impacted more by the pandemic than male business owners?
Well, I'll say this. Under the Raimondo administration, we have established new programming for small businesses. And one of the things that we very much acknowledge is that women-owned businesses often face more barriers, access to capital, historic discrimination, and other biases, as is true for minority-owned businesses. So we do need to make special effort under the ordinary times. In the old normal, we had to take special effort to ensure equity and access for small business owners, including women-owned businesses, and we've done so. I'm proud of the fact that in the first ever state-financed small business loan program, our SBAP program, we've offered more than half of our loans to women and minority-owned businesses. Governor Raimondo knows, as an entrepreneur herself, when she established her business in Rhode Island, that it's challenging for women to do business, not just in Rhode Island, across the country and world. So yes, of course, unfortunately, when there are disproportionate impacts within the context of a crisis like a pandemic, the place where those disproportionate impacts lie is for those populations and communities that are facing the greatest barriers to begin with, which is why Dr. Alexander Scott and Governor Raimondo have all along emphasized extra outreach to those that may be coming from behind. So certainly women-owned businesses have faced barriers in the old normal and in this unusual normal in terms of surviving and thriving. So I think that's entirely accurate. And it's been a privilege to work under our first woman governor who gets these issues. She's been an entrepreneur in her background. By the way, Lieutenant Governor McKee is a small business owner, operator, entrepreneur himself, and offers that spotlight as well. So we're very grateful. Was there another question?
Yeah, a question for you and the governor, the new governor. Astonished as we sat here to read, based on the fine reporting of the Providence Journal, that just a mere weeks after Rhode Islanders had patted themselves on the back after dodging the financial bullet of the now Worcester Stadium, which is now the most expensive stadium in minor league sports history, that we are now the proud soon-to-be investors in a soccer stadium. So let's go down the list, if you will. This is a state where small business owners are very often given $500 checks during a state-imposed purge, only because the state can't afford that. This is a state that is literally investing in a business that will act as competition to private investors and private businesses already existing in the state, where we've just spent the last hour and a half describing how they literally can't fully operate. We're investing in a business where the Gillette Stadium facility isn't even sold out for a Major League Soccer game. By what definition of the madness that this state runs in are we capable of a $50 million, including a $36 million loan to a business that may not ever be able to operate on a normal level? Where does this come from?
Appreciate the question. I'm pleased to be able to speak to the Tidewater Landing project on this day. One of the things that Governor Raimondo and Lieutenant Governor McKee have emphasized is that this project financing must be revenue positive. It must, in fact, be a project that pays for itself and more. And, excuse me, I'm going to finish my. Your question was very intelligent, but it had multiple parts, and I'm going to respond. So we're pleased that this is, in fact, a revenue-positive transaction, and we've worked very hard to ensure that it is, in partnership with the City of Pawtucket and with the private partners at Fortuitous. I want to note a few things. You mentioned the Paw Sox and Worcester iteration thereof. I want to point out a few very important things about this project, and we can be very proud of this as Rhode Islanders. Number one, the investments that we are proposing are to the public infrastructure to support the project, not to the stadium itself. The stadium itself, the facility, will be privately financed, number one. Very much in contrast with many transactions across the country, many stadium projects across the country. Number two, as in contrast with the Paw Sox proposal to Rhode Island, The developers of this $284 million project are bringing 5 times more private money to the project themselves, 5x what the Paul Sox owners were willing to do. Also, after negotiations with the Paul Sox owners, we were able to bring forward in that draft proposal from them a willingness to develop 50,000 square feet of ancillary development beyond the stadium itself, 50,000 square feet, the Paul Sox. This development will leverage over 500,000 square feet of development for Pawtucket. Pawtucket is a city that is emerging economically. It's seen very tough times, including during COVID. But I want to note something about Pawtucket and why it's a worthy place to invest for soccer and for economic development. In 1913, Pawtucket held the very first U.S. Open soccer tournament. The nation's first U.S. Open for soccer was held in Pawtucket, Rhode Island, and we're proud of the fact that that precedent set on Lonsdale Field in our very own Pawtucket could be followed through with a development of this magnitude that pays for itself and that will also bring economic vitality to our entire state.
Absolutely. The vaccine subcommittee is legislatively established. It has been in place, brought together by experts, has been critical to our drive forward, and will absolutely be continuing. There's no change. I'm glad to be able to share that and to say thank you to that subcommittee. The transition advisory group that the Lieutenant Governor has mentioned is really his focus on getting input from the community level, municipal engagement, on all the things connected to COVID, which is vaccine prominent right now, but is really focused on his arrival and intel from that transition standpoint. That is distinct and separate from the legislatively acquired vaccine subcommittee that will absolutely continue and guide us through the remainder of this response.
Thanks, everyone. Thank you very much.